Regarding the examination of the reflexes, really we have superficial reflexes and we have deep tendon reflexes. Let's start with the superficial reflexes. تقدر تنطرح اللحم هذا. First of all, I'll check for abdominal reflexes. بس نقدر نشوف بطنه. And the abdominal reflex, you have to scratch, for example, a tongue blade from laterally into medially in the phenomic direction into the symphysis pubis and into the xiphoid sternum. In the same way, the other area to be scratched. Really, this test, this reflex is conducted via T8 into up to T12, and it is lost in any patient with lower motor neuron lesion involving these roots or this nerve, and in any patient with the suprasegmental or contralateral cortical lesion. This is with respect to the upper abdominal superficial reflex. In the lower limb, we have the Babinski sign. Really, regarding the Babinski test, we have to have a key and ask the patient, or tell the patient that you are gonna checking this test. بس حماد راح أطخ رجلك بهذا المفتاح، ماكو مشكلة. And in the following manner, first of all, you have to stroke the lateral side from here up to the base of the small or little toe. If the patient had no response, we can continue into the base of the big toe in the following manner. Okay, and see the response of the patient. Normally, the response is that of flexion of the big toe and the flexion of other toes. This is the normal. Patient who had positive Babinski sign or extensor plantar response will develop this movement. First of all, the hallux will be up, dorsiflexed, and the finger will be fanning of the finger. These are fanning of the finger, and the hallux will be up, dorsiflexed. Sometimes there is a mass reflex in which the patient had dorsiflexion of the ankle, flexion of the knee, and even flexion in the hip. This is what we call it, mass reflex. Sometimes the patient had intermediate reflex. That's to say, the big toe and other toe will be flexed into the plantar surface and then into the dorsal surface. This is also positive reflex and indicate upper motor neuron lesion. If the patient, once you touch his plantar surface, the patient in ticklish manner, he withdraw his leg into his body. This is what we call it withdrawal response, and the test should be repeated. And when you comment upon the Babinski, really we haven't such a sentence that there is no or negative Babinski sign. Babinski sign is pathological reflex. When it is present, we have to say positive Babinski sign or test, and it is better to say plantar response as extensor or flexor. Really, we have derivatives or alternative for the Babinski. First of all is the Oppenheim in such a manner, and then Gordon squeezing of the calf muscle, and then Schaefer squeezing of the Achilles tendon, and then we have the Chaddock by stroking the lateral surface of the foot just like this, and we have the Bing and Gonda. This is the Gonda flickering of the little finger, and the Bing when you use a pinhead over the dorsal surface of the big toe. All these are derivatives for the Babinski, and the candidate or the examiner should look at the movement of the big toe. This is about the Babinski sign. Sometimes the patient had, for example, amputation here, for example, at the knee. One can partially elicit Babinski sign when he or she stimulates the stoma here of the patient and put his hand here over the tensor fasciae lata to see the contraction. If there is a contraction here, this is partial response for Babinski. This is with respect to superficial reflexes. Let's go now into the deep reflexes. First of all, we have to check for the triceps reflex. We will cross the arm of the patient, ask the patient to relax, and then palpate the tendon and strike it. بس تريدك ترخي هسه. And then to strike it. Okay, we will see the contraction here, and we will see also the joint movement. This is with respect to the triceps. Once you finish this reflex, you have to check the other side. على راحتك ترخي. Okay. After that, we will check for the biceps reflex. Put your finger over the biceps tendon and also strike it, and then also check the biceps from the other side and check it. After that, you have to check for the supinator reflex about 2 inches from the radial style of the process here, or you can put your finger so as not to hurt the patient. After that, you have to check for finger reflex in the following manner, and then you have to check for the Hoffman sign by grasping the middle finger and flicker it just like this. If the patient just like this voluntarily, if he had no reflexes can be elicited, we can perform Chandrasek's maneuver. We will show it after completion the lower limb reflexes. In the lower limb reflexes, first of all, the knee joint reflex, you can use this maneuver. Look at the quadriceps contraction, palpate the patellar tendon, and then strike it. Okay, and then you have to check the other leg. This is the contraction. After that, you have to check for the ankle. This is 90 about, and here is 90, and strike the Achilles tendon. Okay, after that you have to check the contralateral contralateral reflex. This is about the lower limb reflexes. This is the ankle, knee, and the upper limb reflexes. If the patient just like this volunteer had an upper limb really weak reflexes, we can perform Chandrasek maneuver to increase the anterior horn cell excitability in the following manner. Either we ask the patient to clench his teeth or to perform fist with the contralateral hand. هسه تصمنا حلقك حال من أقول لك أنا. For example, I'll perform the biceps reflex. هسه صمنا صكنا أسنانك حال 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 قوي. Okay, now we have reflex. هسه على راحتك تفتح لنا إياها. هسه بهذا إيدك صمها هيك حال من أقول لك. يلا. Okay, we have now a reflex. Really, this is Chandrasek maneuver. If we perform it on the lower limb, we can ask the patient, in addition to fist and clenching of the teeth, we can ask the patient to interlock his fingers. هسه ايديك هيك. من أقول لك صمهن حال. Let's take a look at the quadriceps. يلا حال حال حال. This is the contraction. هاي عشت ايدك. Okay, this is what we call it Chandrasek maneuver, or what we call it the reinforcement maneuver. Really, in the reflexes we have some issues other than this. Sometimes the candidate may be asked about alternative triceps reflex. هسه تقدر تقعد. in the following manner. You have to slide your arm here. هسه ترخ ذبح ايدك ذبح. And ask the patient to relax. And then to also strike the triceps tendon just like this. And we have also the hang up reflex or reflex of that of hypothyroidism mainly. So بدك تقعد هنا وتطلع لنا رجليك. اي بدي نفس معك هنا. بعد طلعها لبرا. اوكي تفصل لنا اياها. Just like this in the following manner. As we see here, let's look up the dorsiflexion and then plantar flexion. عشتي ذيك هسه تستريح. Really all this about the superficial and deep tendon reflexes. We have another reflexes which are primitive reflexes that are not routine. Sometimes the examiner committee really ask about the inverted brachioradialis reflex or supinator reflex, or that of absence of knee jar or ankle jar with extensor plantar response. The candidate really should read about these two issues carefully, and all this about the examination and the skill required for the reflex examination.